Your health is probably already being affected by climate change. Summers are hotter, droughts and wildfires are more frequent and severe, hurricane seasons are more dangerous. Diseases like dengue and Lyme are expanding their range, and allergies are getting worse. Our healthcare sector needs to adapt to these growing threats, all while dealing with rising energy costs and combating the affordability crisis. The good news, though, is that many of the actions that protect us from climate change actually will keep us healthier and make care more affordable. Take backup power, for example. Reliable backup power is important not only because we want to be able to visit a hospital when we need care regardless of whether the grid is down, but because closures, loss of cold storage products, and physical damages are incredibly expensive, driving up healthcare costs for all of us. And unfortunately, the number of costly disasters continues to rise. Diesel has historically been the go-to for many healthcare facilities, but more and more are switching now to reliable, renewable backup power because it doesn't pollute their communities with diesel fumes and because, in many cases, it is more reliable than the alternative. The reason so many are able to do this is that in 2023, the Department of Health and Human Services released a waiver to allow them to do so. That document, which is still in place today, allows healthcare facilities to use the power that is best for their community by removing a regulation that prevented them from using renewable backup power. It does not require anyone to switch, it just makes it possible for them to do so if they wish and if that's what's best for their community. That kind of common sense solution is what the Office of Climate Change and Health Equity was created to identify and implement. The office existed for about 3.5 years and was eliminated into January 2025. I worked there for most of that time, and I'm going to tell you a bit about that office's goals, what we did to achieve them, and all the work there is still to do. The Office of Climate Change and Health Equity drew together government, industry, and other partners to better understand, respond to, and prevent the health impacts of climate change. We built geospatial tracking tools to better understand the ways that heat impacts our health, as well as guidance for the health sector on how they can better protect their patients from the impacts of more severe and frequent natural disasters. Things like renewable backup power and better air filtration systems that protect both patients and staff from hazards like wildfire smoke and other air pollution. We also helped healthcare organizations protect patients outside their walls by addressing the hazards in their environment that make them sick in the first place. For patients with serious illnesses, Medicare and Medicaid can cover air filters, air conditioners, and even healthy food. Programs like these have documented cost savings because they keep people healthier and prevent more costly episodes of care down the line. One hospital in Boston even used its own renewable energy to offset its patients' energy bills, helping them cool their homes in the summer and heat them in the winter. That program was partially funded by federal tax incentives. What I love about these stories is that they give a glimpse into a better world, one in which our government, healthcare sector, and communities work together to protect all of us from the health impacts of climate change. The Office of Climate Change and Health Equity is gone, but the work must continue. That's why we, the former staff of the office, wrote a paper with the Carnegie Endowment to share our successes, failures, and where the work can go from here. One place we know we need to do better is in communicating how combating the health threats of climate change will actually make our healthcare sector cleaner, safer, and more affordable. I hope this video made you want to learn more and join us in that vital work. We all have a role to play.